You know, when most of us think of measles, we probably just picture a childhood rash. But what if that rash was only the tip of the iceberg? Today, we're going to dig into why measles is a serious disease that we really need to take seriously, and why the risks go way beyond what you can see on the skin. So, here's a question for you. What starts out feeling like a regular old cold? You know, a cough, a runny nose, but can spiral into some really severe, even life-altering complications? Yeah, you've probably guessed it. We're talking about measles.
All right, to really understand the threat here, we've got to look past the rash. Let's start with the basics. What exactly is measles, and why do medical professionals treat it with such respect?
This quote right here really nails the biggest misunderstanding about measles. Everybody knows about the rash, sure, but the real danger, it's in the after effects, those serious complications that honestly most people don't even realize are on the table. So let's be crystal clear about what we're up against. Measles is caused by a virus, and I want you to pay close attention to that phrase, highly contagious. It means this thing spreads like wildfire, and its potential to cause some really serious harm is exactly why we're talking about it today. You know, one of the most interesting things about measles is how it unfolds. It's not just random. The symptoms actually show up in a very predictable order, almost like it's following a script. Let's walk through that timeline together. Just look at how this plays out. For the first few days, it really just looks like a nasty, miserable cold. But then, right around day 3, a major clue pops up. These tiny white spots inside the mouth, they're called Koplik spots. It's only after that when the famous red rash finally makes its appearance, starting behind the ears and then just spreading everywhere. So really, you should think of these 4 things as a package deal. You've got the red, watery eyes, the runny nose, the cough, and then bam, that telltale rash. It's that specific combination that just screams measles. And this right here is a really important little tip. If you see a rash but there's no cough and no red watery eyes, it's probably not measles. Those cold-like symptoms aren't just the warm-up act. They are a critical piece of the puzzle for identifying it correctly. So we keep saying highly contagious, but what does that actually look like in the real world? Well, when you see the numbers behind how this thing spreads, it's pretty staggering. Okay, first up is the incubation period. For about 10 to 14 days after a person gets infected, they have 0 symptoms. They feel totally fine, but inside their body, the virus is quietly multiplying, just getting ready to make its move. And here's the kicker. A person with measles is actually infectious for about 10 days in total. Get this, that's 5 whole days before the rash even shows up, and then 5 days after. And that's exactly why it's so good at spreading. People are passing it on before they even have a clue they're sick. All right, now we're getting to the absolute heart of the matter, the reason why measles is not something to mess with. The illness itself is bad enough, but the real true danger is in the complications that can come after. Now, most people do recover just fine, but a significant number can get secondary bacterial infections in their ears or chest, which can escalate into pneumonia. But the one that everyone fears, the last one on this list, is encephalitis. That's a dangerous inflammation of the brain itself. And the potential result of encephalitis is just stark. It can lead to permanent brain damage. It's a small risk, for sure, but it's a devastating one that comes attached to every single case of measles. So if there's no cure for the virus itself, what can you do? Well, since there's no specific medicine that kills measles, managing the illness is all about what we call supportive care, basically helping the body fight it off while keeping the person as comfortable as possible. At home, it's all about comfort while the body does its work. Rest is absolutely key. Avoiding bright lights helps soothe those sensitive, watery eyes. Drinking lots of fluids helps fight dehydration from the fever, which, by the way, you can manage with paracetamol, and a simple cough medicine can help with that hacking cough. But, and this is so important, you have to stay vigilant. These symptoms right here are major red flags. A severe headache, a stiff neck, convulsions, or being unusually drowsy could be signs of that brain inflammation, encephalitis. Breathing problems could mean pneumonia is setting in. Any of these mean you need to get medical help right away. I know this all sounds incredibly serious, and that's because it is. Which brings us, of course, to the single most important question of all. How do we stop this from ever happening in the first place? This is the question that really matters most, isn't it? When we're facing a virus this dangerous, what is our absolute best line of defense? What's our most powerful tool for prevention? The answer is simple.
It's clear, and it's backed by decades of science. It's vaccination.
So here's how it works. The recommended schedule is a 2-dose process. The first shot is usually given around 12 months of age. Then, a second dose is given before a child starts school, somewhere between 4 and 5 years old, and that's what helps provide lifelong protection. And this is absolutely crucial. To make sure everyone can get this protection, the vaccine is provided completely free of charge. We're going to leave you with this final thought, which is powerful and couldn't be more clear. After everything we've looked at today, it's obvious that the best and safest way to handle measles is simply to prevent it from ever getting a foothold. Thanks for tuning in.